Hello and welcome to the Canine Rehab Movement Podcast, where we discuss all things canine rehab, fitness, and sports medicine for our four-legged companions. We cover a variety of topics with amazing guests in an educational and entertaining format. Some would even call it edutainment. Now, we are all about canine rehab and fitness training, or craft. So join us and hone your craft with the Canine Rehab Movement Podcast. Now, today's episode is sponsored by Zomedica. And at Zomedica, they're committed to meeting the needs of clinical veterinarians and rehab therapists in ways that promote both patient and practice health. It is their mission to advance the effectiveness of veterinary practitioners and rehab therapists by offering innovative, unrivaled products and services. So thank you again, Zomedica, for sponsoring today's episode. Hey guys, and welcome back to the Canine Rehab Movement, the podcast where we dive deep into the world of canine rehabilitation. I'm your host, Anthony Schena, CCAT, owner and operator of Alpha Animal Rehab and Fitness, and director of operations of Underdog Business Solutions. Now, these powerful tools and techniques help animals recover from injuries and surgeries and chronic conditions, improving their overall mobility and quality of life. And today, we're lucky enough to be joined by Dr. Matt Brunke, a leading expert in canine rehabilitation and sports medicine. Dr. Brunke, thank you so much for joining us.
Thanks, Anthony, for having me.
Yeah, we are thrilled to have you. Now, modalities are such an important part of rehabilitation. And today we'll unpack various types of modalities, including laser therapy, shockwave, electrotherapy, you name it. But first, Dr. Brunke, could you give us a broad overview of what we mean by rehab modalities in the context of canine rehabilitation?
Yeah, that's a good point, right? So when we think about these, they're some of the tools in our toolbox to make things feel better or to help things heal. The first step before that, because they can be overwhelming, of, okay, which ones are we going to talk about? Which ones are we going to use? Go back and first get your diagnosis, right? Figure out what the problem is. And now you can bring in these electrophysical modalities and go, okay, these are things that we've moved beyond pain meds, or the patients aren't responding just to oral pain medications, or maybe they can't take them. And now we have these opportunities to go, okay, how do we influence tissue healing? Mm-hmm. What things can we use? That's things like laser therapy, certainly electrical stim, extracorporeal shockwave, and pulsed electromagnetic field. These are the core four that we start to look at in that space of modalities.
Mm-hmm. Yeah, absolutely. Modality is, for me, a cornerstone of many rehab programs. Can you explain how you, as a rehab specialist, choose the appropriate modality for a particular patient?
Yeah, that's always a fun one, right? It's figuring out what the whole situation is. So can the patient come once a week? Can the patient come 3 times a week? Can they even come at all? Where do we start to pick those things, and what capabilities from some of these modalities do we have for the pet parent to be involved in at home? Absolutely. So it's finding that balance a bit of sitting there and going, okay, I know what's wrong. What are we trying to achieve in the next 4 weeks or 8 weeks with this? Because for the most part, that's when I'm using modalities, unless I'm into maintenance. I'm not using modalities a ton. I'm using modalities to get me to exercise.
Yeah, absolutely. I agree. That's the concept, right? Especially in our initial phases, we want the animal to be comfortable enough to move, right? Because we know at the end of the day, the movement is going to be the overall medicine and what keeps you out of rehab. Yeah.
So with those, I just go, okay, what can I use? What's my diagnosis? If I'm dealing with cancer pain, a lot of our modalities are off the table as an option. If we're dealing more with arthritis pain, when we look at all these research papers, about 80-ish% of patients improve on these different modalities.
Yeah.
That means 15% don't. A little bit of this is trial and error and to give it time. So I may start with one and go, okay, can I get them comfortable today? Can we do something basic for next week? Can we be walking a little bit more? I'm not the old adage of Rome wasn't built in a day. The same thing, right? One treatment of laser is not going to get you all those things perfect. But perhaps like one treatment of shockwave might be enough to really boost them. And that's a helpful modality because we only have to do it about every 2 to 3 weeks, certain types. To me, with that electrohydraulic shockwave, if I can come in, the patient can only come to me 2 or 3 times over the course of 3 or 4 weeks. That might be the modality I use because laser, we know we do need a little bit more often. So that's that type of timeline. I'm always trying to figure out the grander picture of what's going on with that individual patient.
Absolutely. It's a very individualized approach, right? All the research, we want to follow that, obviously, but each patient could respond differently and not exactly how the research papers show. So yeah, there could be a lot of trial and error still. You might just have this upfront arthritis patient, but maybe they're not responding right away. And maybe you have to think outside the box a little bit. But I have to say, I'm super partial to shockwave. I've used it in the human world, and I was so glad that it was able to translate into the animal world now, too. And I've seen a lot of really good success with it, where I like to use it first and do a 1-2 punch with a laser follow-up. It's really been very helpful. But what about you? Can you give us a few examples of conditions or injuries where specific modalities are particularly effective?
Yeah, it's funny. Shockwave was something that when I started back in rehab, back in the late 2000s, right before even the 2010s, aging myself a bit. But shockwave was that one that we couldn't use unless we sedated everything. We didn't have that modality as a more practical modality like we do now. But we had so much great research from the human side where they could do it awake and they could do standing sedation in horses. So it was always that modality. I was like, man, I wish we could optimize this for what we need in small animal rehab. And now in the last couple of years, we really have, either between piezoelectric, electromagnetic, and now with the revamped electrohydraulic shockwave that can be all done awake. This is now something that we really reach for because we can knock down, especially tendinopathies, right? Like shoulder tendinopathies, maybe something to really knock down some elbow away. And there's some research coming out probably later this year, 2024, maybe early 2025, that's actually going to show shockwave as an effective modality for lumbosacral disease.
Oh, yes.
So those are probably my big 3 where I'm reaching for shockwave. I'm like, can I knock down a really arthritic joint and do it all awake, especially in an older patient where I don't have to sedate them, or LS disease or shoulder tendons? Those are my big 3.
Yeah, I love those. I definitely attack those 3 myself. I've particularly been finding it helpful with actually partial CCL tears. Not that it's reattaching the ligament or bringing it back, but I've seen where we've been able to really help with conservative management, especially with those pet parents that unfortunately can't afford any kind of surgery or anything like that. So yeah, and then the lumbosacral, I've found it to be really helpful. When I have an arthritic patient or a senior patient, I immediately go to the back first. And then I work my way down through the extremities. And it really is so helpful for them.
Yeah.
So let's dive into the details of some of these modalities. While we're on the topic, let's start into shockwave. Could you explain how it works and why it's starting to become a cornerstone treatment in canine rehab?
Yeah, the use of sound waves, right? With all of these modalities, electrophysical modalities, we're trying to use different ways to stimulate tissue healing. And with shockwave, kind of sounds a little weird, right? Like shockwave things. We're using sound waves, right? So that those sound waves have to come from some sort of generating device. In fact, this was really pioneered years ago with what's called lithotripsy, where they use sound waves to help vibrate tissue and actually can break up kidney stones in people without having to operate on the kidney. So those sound waves come from a generating source, whether that's piezoelectric, electrohydraulic, or electromagnetic. And those are focused shock waves. So they're sending out that wave and that's hitting that target tissue. And those are then influencing the cytokines and the tissue healing. And the fun part about it is, at least on the recent human systematic reviews, is that whether it's electromagnetic, electrohydraulic, or piezoelectric, they didn't find a difference in the tissue healing.
It's pretty interesting. Yeah.
It may not matter, but you have to figure out what works best for your patients and your capabilities, et cetera.
Absolutely.
And then there's radial shockwave. So radial's the older one. It's not focused. It's dispersing that sound wave out over a larger area. But that, too, has its place in maybe trigger points and treating larger areas.
Yeah.
Imagine like a massage gun on steroids. Right?
Okay.
You're focusing an area. Right? With a massage gun, you're actually vibrating the tissue. Right? You're mechanically stimulating it.
Yeah.
This shockwave is generating a sound wave that is then impacting that tissue.
Yeah, going deeper than the massage gun could ever go, or even our hands, obviously. Yeah, very cool. Let's get into one that's already a cornerstone, right? Laser therapy. I think most of us do know about laser therapy, but for aspiring listeners out there that are starting to be curious about canine rehab, let's get into what laser therapy does as well.
Yeah, so here, one of those other electrophysical modalities, instead of sound, we're working with light. So laser, or light amplification of sustained emission of radiation, that's what the acronym actually stands for.
Yeah.
Using those photons with different wavelengths of light to actually stimulate the cells and provide them more energy.
Yeah.
If you provide cells more energy, then they make the healing process speed up. And so you can then use that to downregulate pain, upregulate tissue healing by providing the cells a little bit of that energy boost.
Yeah. And I love that about the laser because that's our job, right? Whether it's in rehab, physical therapy, we're there to facilitate the body, right? To heal itself. The body's doing the work. We're just the people on the runway pointing this way, pointing that way, making sure it's doing the right thing or helping it to go a little faster. So yeah, I do love that about laser therapy. Especially on our arthritic and senior dogs and animals.
Right. And this is a cool area because there's different classes of lasers. You have barcode scanners. You have all sorts of lasers and light. But as we get into these, we're not talking about the surgical cutting lasers, but really using infrared or near infrared technologies. But we're using that with different power and structure. So with those, sometimes that's in the clinic and really can be almost as potent as giving an opioid for pain. It may not last very long, but can we really knock down the pain with that? But can we also then use that repeatedly to help give that tissue some healing, some extra energy? And can we also use it in the home setting? And there's actually some lasers out there now that are safe enough to be used at home. So we make videos and teach the owners how to do it on their pet. And then we can send those lasers home with those folks so that if they can't come into the center as often as we would like them to, they can still be active participants.
Yeah.
Actually, I worked on a research project on that at-home laser, one of the at-home lasers, looking at dogs still in the rehab space, but we actually looked at dogs with cognitive dysfunction, which is similar to Alzheimer's in people.
Yeah.
And Curtis Dewey, who's a rehab certified practitioner, also a neurologist and surgeon, he and I worked on a research paper with our research team, and we could use the parents of these dogs with cognitive dysfunction to laser their dogs' brains at home, and they actually improve their cognitive function. So this is not something rehab kind of gets all the geriatrics, all the other things that aren't right. So here's an area with evidence that we got out this year showing that we can help and you can empower the parents and the families to be part of that process.
Yeah, it's really amazing stuff. And I truly like being able to empower that pet parent to do as much as home too. It all starts obviously with the home exercise programs, but some take-home things to continue the process, I think, helps to empower them and keep them doing it at home, because I think you and I both know we obviously believe in our work when they come in for that treatment, but a lot of times most of the work needs to be done at home to really meet those functional goals. So whatever they can use and whatever they can take home can be really helpful.
Absolutely.
Now, you also mentioned electrotherapy or electric stimulation. Let's talk about how that works and how you integrate it into some of your treatment plans.
Yeah, the two main types of electrical stim that we think about are going to be what we call TENS, or transcutaneous electrical nerve stimulation, and then NMES, or neuromuscular e-stim. NMES first. This is the one back in the day where you could buy the ab belt and just sit at your desk and the muscles would get contracted by the electrical stimulator.
Yeah.
Okay, it doesn't replace exercise. Right? But it can be a helpful component in those dogs and cats with lower motor neuron problems. And so those animals that have peripheral nerve issues, can we help by, when they're not up and walking yet, can we use e-stim to give them some muscle contraction and at least slow down the rate of atrophy? And that is a finely focused area, but one that we can be very helpful with. The other one, or transcutaneous electrical nerve stimulation, or TENS, these are ones we use predominantly for pain relief. So we can use them over incisions. We use them over just recovering painful areas. And hopefully you're taking care of yourselves out there too, but these are ones you can actually operate with, like little 9-volt batteries or AAAs, and you can clip it to your belt and walk around with it on. We know that, unfortunately, the pain relieving aspects don't last very long once it's been turned off, but it can be something helpful to use in those acute pain flare-ups to get us some pain relief.
Yeah, absolutely. I love the NMES for our neuro patients, especially really getting those muscles to try and refire. And like you said, trying to slow down or stop atrophy from that condition that they're suffering from. It can be really cool to help help facilitate those muscles just from a sit to a stand. And yes, the TENS is really great for pain modulation. Sometimes just starting with that, especially with my senior dogs, I throw a little heat around a more severe condition, arthritic condition. If say it's their hip, throw a little heat and a little TENS on there for some pain modulation, and they start to feel loose and feel good. And they're an active participant in some of the lower grade exercises to help strengthen and stabilize around that joint. So it really has a lot of good benefits. I also enjoy using it as well. But yeah, it sounds like you use a combination of modalities for the most part for your patients, right? How do you decide when and how to integrate these modalities into a single treatment?
Sometimes it's going to be just looking at that patient that day and you're like, okay, they're their fourth or fifth session. They should be pretty good, but they overdid it at home the day before and they're really sore. So that might be one that you're like, okay, let's get in there. Let's laser that area. Let's knock that down. Let's get a hot pack. Give them a little bit of time. And then can we go stretch them, go exercise it, and bring in e-stim later? Or some of the ones I'll look at that and go, okay, I know we're on a time crunch. We have a lot of patients. The owner has to go. Those might be the ones I say, okay, if you're going to overdo this a bit, I need you a little more actively participating at home in the pain relief process. I'll actually usually send home a PEMF device, or a pulsed electromagnetic field device.
Yeah.
Really can be a helpful area. Now we're getting into, with e-stim, we're talking about depolarizing nerves and finding those right areas. Now we're taking electromagnetic fields and altering that, which has been shown on a cellular level to also increase tissue healing and downregulate nerve pain. So I'll send them home with a PEMF device and go, okay, I need you to do this at home during that process. But it's not just that I need them to do it, not that I believe in it. I do, but it's having the research to back it. And with all these different PEMF devices, they all have different electromagnetic signals. So you have to look at each of those patients, same thing with laser or with shockwave. You have to look at each individual device's particular research on their particular device
Mm-hmm.
And with the PEMF device, the Assisi loop, they've studied that in dogs at two different centers, one up at AMC in Manhattan, the other one at NC State's vet school.
Mm-hmm.
Dogs recovering from spinal cord injuries, specifically type 1 intervertebral disc disease, going through surgery, and they had a control group and a treatment group. And in both studies, the treatment group did better than the control or sham group in both the acute recovery and the long-term recovery of those patients. So if I need a patient involved, and especially in intervertebral disc disease with all these Frenchies we see now, I'm usually getting them going, okay, I can pick this modality to exercise you, things I can do, or my team rather, can do in the clinic. But as part of just getting that dog in that healing process, with a PEMF device, they just have to lay there for 15 minutes. So for those owners, hey, just put this on, leave it on, do its thing, let it do it a couple of times a day. You are, even though it looks fairly passive, you're still part of that active rehabilitation process.
Totally. Yeah. A lot of times I have pet parents looking and they're curious because through all of our treatments, our PEMF mat is integrated into kind of that lounge mat that we have our patients on. So the pet parents never really see it at first and they're always curious. You mentioned PEMF. When does that start? And we excitedly tell them it's been on. It's been active. They're great, like you said, passive aggressive treatment. Yeah, and I'm glad you brought it up because there's a lot of research behind it on so many various conditions. It really is a jack of all trades when it comes to a modality to use, for sure. Moving on more towards, do you have a particular case where this kind of multimodal approach was super key for one of your maybe more challenging dogs' recovery?
Yeah, there was this older corgi that had come to me years ago that was just known to be, or it was labeled as this little land shark. Right? It was this corgi that just was cranky and had to be muzzled and just was one of those older corgis. And he had trouble. Right? He was weak in his back legs. He had motor function and was ambulatory. So he wasn't in need of surgery, but he just had chronic multifocal intervertebral disc disease.
Yeah.
And he was one of my rehab patients back when I did GP rehab. And he had to wear an e-collar because that was the way we kept his teeth away from everybody. And he was this cranky guy. And we didn't have a lot of other tools at that point. We started with laser with him. And he would sit there and say, okay, you can laser me. We'd e-stim him. He wouldn't always sit for it. He was always cranky about the clippers and all these other noises and things. And so what we wound up doing was actually getting him involved with a PEMF mat in the clinic and had the parents start doing it at home. And about 3 weeks in, he had slipped off his e-collar and I was like, I'm trying to like exercise him. I'm like, okay, he's going to go ahead and try to just absolutely bite into me. And he just rubbed his head into my hand. And we figured out that most of his snarkiness was his presentation of chronic pain. Because once we started actively PEMFing him routinely, and granted, if he missed a treatment, his pain was pretty bad. Right? But he was this older dog. He was in early renal failure. We couldn't use things like NSAIDs and amantadine. Right? GABA made him really sleepy. So here's a dog who can't take polypharmacy. And we actually unwound his chronic pain. He was this really nice older dog after that. And that to me was a huge wake-up point in my career.
Yeah, that sounds like an amazing story. And I think there's a lot of insight there too when we always try to be safe and protect ourselves as well when we know there's an aggressive dog. Sometimes we have to look a little bit beyond that aggression, and maybe it is because they're in pain, right? So the behavior of that animal changes too. And I think it's really good to make sure as a practitioner to ask about that in the initial evaluation. If there's been behavioral changes, was this dog a really sweet dog and now what's going on? Is it snippy? Is it grumpy? Things like that, where it can really help you, right? And now you're focusing on, okay, maybe we can get this animal back to its normal behavior, and you don't have to worry about sometimes with aggressive dogs, the muzzling factor and things like that. Yeah. Really good insight there.
And then the one I had that came to mind recently was from a shockwave perspective is we had this seeing eye dog, and their job is to get their person around every day, right? And this dog has mild, almost moderate lumbosacral disease as an older dog. And they're in the process, that dog will retire soon, but the dog wasn't ready yet. And so here we are trying to get this person around the Washington, D.C. area where I practice. And it's an active lifestyle. They have a lot of walking to do. And dog's got LS disease. And here we are, and we're on oral meds, great, but we're still uncomfortable. We're trying to be functional and do this type of stuff. And another way I'll treat LS disease is I will.
Hey guys, I hope you're enjoying today's episode of the Canine Rehab Movement. I just wanted to take a hot minute to talk about something that can make a big difference for both you and your furry friends. This episode is also brought to you by Multi-Radiance Medical. Multi-Radiance lasers offer the most clinically valid light-based solutions, built with your patients and practice in mind. Multi-Radiance's unique superpulsed laser technology safely delivers the most light to deep tissue and facilitates absorption to accelerate healing and reduce pain in pets. Treat animals in the clinic with the High Power Activet Pro series. Then, continue treatments in the comfort and safety of their own home at their schedule with the My Pet Laser 2.0. Visit vet.multiradiance.com today to learn more and schedule a demo for your practice. All right, guys, let's get back into it.
Treat LS disease is I will do epidural steroid injections under anesthesia. But in this case, when we do, that person can't use that dog for that day, and sometimes a day or so after, as they're just coming out of that heavy sedation. I don't usually have my working dogs work the 24 hours after an epidural because I want them to let that settle in, get back to normal. But this is a dog who has to work 7 days a week.
Yeah.
So what we did was we got out our PulseVet, our electrohydraulic shockwave, and we did a series of shockwave treatments that we could do on an outpatient basis with that dog. And there's this dog just going, cool, I can go back to doing my job. Right? Was able to go up and down the subway steps, do all the other things. And they came back in for the other follow-up treatments. Yeah, we don't need an epidural in this case. This dog's moving around. It's great. We're doing it on an outpatient basis. When we need it, we only have to do it about every 3 weeks. Right? We did a series of 3 treatments, 3 weeks apart. And that got us about 6-8 months of improvement. And we just did another series of 3. That's not that hard to get these things going and be really practical in your modalities.
Yeah, no, that's a really great story. And I'm already sold on shockwaves. Coming from the human world, seeing what it can do for so many various conditions, and hearing this kind of success story, especially for a dog that has a major purpose in life, helping somebody with a disability get by. It's super important, and it really is so nice to know that there's something out there that can help these animals in that way, for sure. I remember you mentioning before in this conversation, massage guns. I don't know if you yourself use massage guns. I do. And it all started with my guy, Miles, who's 15 years old now. And I bust out the massage gun and he just sprawls on his back and says, do with me what you will. But it's not for every patient. That's for sure. Just wanted your take on that as well.
Yeah. One of the fantastic things about massage guns is that they not only can make the patient feel better, but they are sparing into the practitioner's hands, right?
Yes.
Exactly. The other IASTM, the instrument-assisted soft tissue mobilizations, blading, stuff like that Kirsty Oliver and Dave Levine and Deb Taraka and I have all taught on. We'll use these other things.
Yeah.
But with massage guns, it was funny during the pandemic. Of all things, one of the editors of Shape magazine reached out to me at the office. And I was like, okay, sure. And they're like, we want to talk to you about using massage guns on pets. And I was like, where is this coming from? And they were like, it's the pandemic. Everybody's working from home. I'm like, not vet med, but okay.
Yeah.
Everybody's working from home and everybody's got pets and they want to massage their pets. And so we actually did this piece that made it to publication in Shape. And we talked about just the big safety aspects. And that's the big thing,
Absolutely.
Right?
Yep.
You use a massage gun in the wrong place, on the wrong area, and you can do a lot of harm, especially like a cat or a small dog, right?
Yeah.
Being a trained practitioner and professional in rehabilitation, yes, we will use massage guns in big areas, get the animal acclimated to it, absolutely, and be very careful with the settings. But that is actually one of the modalities I don't recommend owners do at home just because there's so many variables. And rule number one is always do no harm. But they are a component there. They absolutely are. It's just how to phase them in safely.
Yeah, for sure. Us as practitioners, we know the use of this instrument, right? It's for soft tissue. Owners at home don't always know that maybe they should be palpating the surface first and following with the gun second, making sure no bony prominences are being hit, things like that. And obviously, if the animal is truly uncomfortable, say they have an iliopsoas strain, they don't know for sure the pressure, the speed, the things like that will help it instead of hurt it in that sense. So yeah, totally. I think the biggest thing is if a pet parent does mention that they have a massage gun at home, education is key. Education is always key when it comes to a pet parent. And you can go over it, see what kind of brand they have, maybe have them bring it in, feel the intensity of that gun, and then move forward whether or not they should be using it at home or we got it from here kind of deal, for sure. Yeah. But yeah, with that being said too, as that's more of a, I guess you could say, newer technology being brought in. Have you seen any other kind of newish kind of technology out there? Or is it all at a point where it's shockwave laser, electrotherapy, PEMF, things like that, and more just newer research?
I think a lot of it is newer research and kind of refining the doses and the parameters. The big change for me, obviously, electrohydraulic shockwave going from requiring anesthesia to, there's a published study out of Colorado State, 85% of patients you can do it wide awake in. So though I think it's really refining and bringing it into more focus and making it more practical and accessible, then there is a big area to go, a new modality. We're still working with those. New modality, there's been some interesting research on different beds. So using orthopedic foam or memory foam, but using orthopedic foam into some beds and showing that animals can actually rest better, which I think is really important in taking care of them.
Right. Absolutely.
And then a lot of the transition, when we started with lasers probably 20-ish years ago, we said class 3B was safe and we didn't know much about class 4. Then in the evolution of it, class 4 became the workhorse that we knew we would do safely in the clinic. But now the class 1 medical lasers, so the handheld ones that are more fine-tuning into tissue fibrosis and modulating pain, even killing bacteria and viruses with blue light laser, that's now come around. So it's interesting to see the evolution of the areas and not necessarily a change, right? I think there will be some other cool changes. I think there's some really probably potent PEMF devices on the human side that we may see in the clinic in the next couple of years in animal rehab, but I'm not sure yet that there's not a brand new area. It's more just that fine tuning and further knowledge.
Yeah, and I think that's a good course to go, right? We want to make sure we're not just overloading each practitioner with all these modalities and have a pretty good core of modalities and refine them, research them, and make sure that these are the modalities that we should be using. But yeah, I like the topic of 3B versus class 4 in laser. I think there's a lot of practitioners out there. That's a hot topic, right? You have I wouldn't say a divide, but you have the advocacy of 3B is good enough. There's no reason for class 4. And then you have class 4 can really help your practice in time management, workflow, things like that. What's your hot take on that?
Similar. You're trying to keep up with the human research too. I'm seeing more work on class 4s, the evolution of class 4. When, for example, we used to think for class 4 lasers that 10 joules per centimeter squared for some of these was the dose for arthritis. And then there was a really nicely done paper by Andy Looney and Jan Huntingford, 2 veterinary sports medicine specialists in our field. And they found that 20 joules per centimeter squared was not only safe, but also efficacious, and more efficacious than the 10. So it's not just getting stuck in what your presets are. Keep up with that evolution. And then the other thing on the laser side for me, which I lean more, I think class 4 is just, they're starting to see on the human side more systematic reviews of the safety and outcomes. Even now, the change from, it used to always be all continuous wave light output, and now a lot of these devices that can do pulsed and even super pulsed. A lot of the lab work with super pulse lasers has shown that super pulsing light can actually help the cells to essentially open the doors and open those gated channels, that the continuous wave light can actually be more effective in reaching the target tissue behind that closed cellular door. So to me now is, how do we get more energy there? How do we be more effective? Instead of getting scatter, instead of getting reflection with laser light, can we get it to the target? And so these are some of the cool things that are out there, and it's keeping up with the research and seeing what changes.
Yeah, absolutely. Yeah, these various layers, obviously, the lasers have an easier time going through the layers of a human being than an animal with fur and all of their thick skin and hide and stuff, depending on the animal, obviously. So yeah, making sure the actual energy that we're trying to put to that area gets to that area. And that, for me, a lot of times is helpful when I can set parameters. When you can set parameters, then you just have a higher chance of that dosage actually getting to the area that you want. And for me, that's where the class 4 has come in. I hadn't seen a lot of 3Bs where you can set parameters. That was the biggest thing for me going towards more of the class 4. And obviously, yes, the research is just showing how much more efficacious it is. But yeah, it still remains a hot topic till this day. That's for sure.
And it's even within the details of the different topics, right? There's probably some good research out there that we should probably be shaving most of these animals, the laser effectively down there. And sure, if they're immediately post-operative, that's a great time to use laser. Right?
Absolutely.
They're there, it's already shaved, cool, go for it. But if you're into maintenance mode, then maybe that's someone you choose PEMF for instead, or you pick a different modality. Even with shockwave, right? Air is the enemy of sound in that scenario.
Oh, yeah.
So we need a coupling gel. Can we use the coupling gel with shockwave that might allow us to not have to shave that area? Right? But making sure that it doesn't matter how nice of a device you have, if you can't get the interactions set the right way that you're actually delivering it. So those are honest conversations to have with pet parents. Hey, if you want us to keep doing this, we need to potentially shave your giant matted cat, dog, things like that. So those get into that intricacy of what are we trying to achieve? Are we shaving a focused area? As a complete unrelated, but relating to this rehab field, my own dog years ago, I had a big Newfoundland, and when she was in full coat, she weighed 120 pounds.
Yeah.
And when I brought her to the groomer and we brought her down to puppy cut and kept her lighter, Anthony, how many pounds do you think less she weighed? How many pounds less?
From the fur?
From 120 to a puppy cut. Yeah.
Oh, man. I want to go high here. I want to say like 15, 20 pounds.
Not 20, but 15. 15 pounds.
I knew it was around there. 15, 20 pounds. I knew it. That's crazy.
And then she had shoulder OCD that we had to operate on and clean out, so she had some shoulder OA. She, of course, had hip dysplasia. But I could reduce her body weight by a body condition score by 10% just by keeping her in puppy cut.
I know. That's crazy.
And so we kept her in puppy cut. That was easy. We also kept her lean with a lean BCS anyway. But we could drop so much weight off of her that we did that. It was actually easier for me to do the modalities to her when she didn't have that big coat. And it was easier in general just for her to maintain herself. So finding just different ways to be creative in rehab, I never would have thought that just having her cut down as much would really be impactful, but it was a huge impact in keeping her moving forward.
Totally. And you think about that with dogs, especially 10, 15 pounds is huge for them, right? So just their fur maintenance of taking off 10, 15, 20 pounds is astronomical for their joints alone.
And not only for those ways, it's easy kind of to see, but we start to apply that to older geriatric Shih Tzus and Lhasas and all these things that are, it's really hard for them to maintain their coat if they're painful or arthritic. And so we started doing this too. And that dog might only lose a pound or two, but percentage wise, it was still losing 10% of its body weight. Yeah. So we know the importance of going from a BCS of 6 out of 9 to a 5.
Oh, yeah.
If we could do that just by a regular haircut, that's an easy win.
Yeah, it's I don't know for the listeners out there, but it's an eye opener for me too. And I've already thought of a few patients that I might actually suggest that to the owners because they're definitely older patients, very shaggy, and this could be another way of helping their joints for now, and so that they can strengthen now. And then if you want to get that shagginess later, at least we were able to work on that. Yeah.
And I'm not saying to bring them all the way down to skin tight.
No, of course.
Just a little light puppy cut, keep it easier. It's less things to get tangled. It's less things for them to clean. It's easier. Our whole goal in rehabilitation is helping patients fight gravity. Right? If we can fight gravity, then we can stand, then we can walk. So anything that reduces our weight load helps us to be more effective in fighting gravity.
Absolutely. No, that was a really good insight there. I got to jot down my list soon of all my patients now.
It doesn't have to be the most complex thing. It's sometimes the simple solution is really the solution.
And that's where I had mentioned thinking outside of the box, right? You really got to just look at that animal in all aspects. So thanks for that little insight for sure. Mm-hmm. So as we approach the end of our conversation here, I'd actually like to switch the focus on like practical advice for both current rehab professionals and those who are aspiring to enter the field. Specifically, what advice would you give when it comes to utilizing and mastering these rehabilitation modalities?
Don't be afraid to make a mistake. Right?
Yeah.
Practice makes all the little things here. I'm just about to say, practice makes perfect. These take time. Read up on them. Ask a friend. Right? Ask a fellow colleague. To the sales reps from that's their job. They're supposed to know these products inside and out. But then ask them for the research on it and spend a little bit of time reading the research, seeing what's out there, gain a little bit of knowledge into this, so you're comfortable with it. And it's a process. I did not think I would ever be here talking with you, Anthony. We keep learning. So just be patient with that. Realize that it's another skill, but just be methodical with it and don't be afraid to ask for help.
Yeah, no, it's a really good point. I think the biggest thing for all practitioners, all professionals is the pride aspect of things. No matter if you've been in for a year or if you've been in for 10, 20, the biggest thing is keeping that open mind, always asking for help and always looking to others as well. Don't just stay within. The best way to grow and master something is by speaking with other professionals, not just doing it yourself. And you got to stick up with the research. The research is super important. So it's a really good point you brought up for sure. Yeah.
Try it on yourself too. I used to take different devices and go for a run and try to see if would it make my ankle feel better? Would it help my dog around first? I would try it on simple stuff first and just see and just keep working with it. So there's no magic creation step there. It's just being practical.
Yeah. Totally. And I think that's the other good point there is testing it on yourself, right? Feeling what your patient's going to feel, having that better understanding of how that shockwave is going to feel on your patient and why they might initially not want to be touched by it. And maybe you have to dumb down the parameters just for that animal to acclimate and feel comfortable with it before you really get into that therapeutic mode of it. It's all trial and error, and there's always a guideline, but sometimes you might have to go off the beaten path. Yeah. Thank you so much for this insight, this advice. It's clear that a deep understanding of each modality paired with the ability to adapt and layer these treatments is obviously super successful for any rehabilitation practitioner practice. And I want to thank you so much for sharing your wealth of knowledge on these modalities today. It's been incredibly insightful.
Yeah, it's a lot of fun, and it's one of those pieces, kind of tools in our toolbox, right? Like, we've got this figured out, we can add in, and let's just, how do we get to exercise? How do we make the patient better? And how do we maintain it? So, yeah,
that's what it's all about. Get them out of pain and get them moving. That's how we reach our functional goals with them. Yeah. Thanks so much again for joining us, giving us your time. I know you're a busy man. I don't know how you do it, but I praise you for it because you are nonstop, my friend. You are nonstop. And to all the listeners, thank you so much for joining us today. I hope this episode has provided you with a deeper understanding of various rehabilitation modalities that are available out there and how they can be used to enhance the recovery and performance of all of our patients. So be sure to tune in for our next episode. And this has been the Canine Rehab Movement. Thanks so much, Dr. Brunke.
You've been listening to the Canine Rehab Movement Podcast. Thank you for tuning in. And for more information about our programs, please visit ncsuvetse.com. That's ncsuvetse.com. And for those of you who've made it to the end of the podcast, use the discount code NCSU100 and save $100 off of any course, $4.99 or more. Until next time, guys, this is the Canine Rehab Movement Podcast.